In San Diego County, African-American infants are nearly 3 times more likely to die before the age of 1 compared to any other ethnic group. ABC 10 News anchor Nia Watson looks into the efforts aimed at improving the health of black babies and their mothers and what more can be done to close that gap.
Good girl.
Dr. Meredith McMullen has a unique perspective when it comes to black maternal health.
This is Caroline Aurora. We love to call her Cora for short.
She's a black mother giving birth to her 3rd child 5 weeks ago.
She's my little bundle of joy. She's my miracle baby.
But even with having more knowledge than most about the topic, it doesn't shield her from the greater risks black women face during pregnancy and delivery.
Right here, the circle right here is your sister's head.
It turns out that during the pregnancy, I was diagnosed with preterm labor at 28 weeks. It was just really scary.
Black infants in San Diego are nearly 60% more likely to be born premature compared to white infants. Black mothers are nearly 3 times more likely to die during pregnancy and delivery, according to the CDC. McMullen says why is a complicated answer, but a combination of medical and societal factors.
For example, a lot of my patients might come into pregnancy with pre-existing conditions like having high blood pressure or having diabetes.
But medical conditions, McMullen says, can be worked on to lower the risk of complications. It's the societal stressors like the lack of support or finances that are harder to overcome.
This is not just a African-American issue. This is a community issue.
Rhonda Freeman oversees San Diego County's Black Infant Health Program. For more than 3 decades, the program has provided healthy meals, transportation to appointments, and group sessions for black families.
We talk about health issues. We talk about, the whole birthing process. They're actually linked with a public health nurse. There's a family health advocate. We also have a mental health professional.
Another resource for women of color is the Southeast San Diego Breastfeeding Clinic. It helps with things like bottle feeding and pumping.
Plus, black women are more likely to return to work sooner, which is why it's important to help with pumping.
Sharday Bell is a board-certified lactation consultant. She says the black community has the lowest breastfeeding rates compared to any other race.
And that's not due to a lack of education, but it's rather due to the fact that we don't know that the supports and resources are there for us and that we can access them.
Along with helping mothers breastfeed, Bell says she wanted to create a safe space to support families of color.
Just needing another mother to hear them out and know that they are going through similar things, that often helps them to get through the whole life of parenting, especially if you are a first-time mom.
McMullen says it's important to create a welcoming physician-patient relationship as well. She says black women make up less than 3% of the physician workforce in the U.S., so diversity, equity, and inclusion training is crucial.
And knowing that our patients of color might come in with a higher incidence of something like fibroids, where, this is something where we need to ask the right questions.
She says women should also listen to their bodies, stay on top of their appointments, especially first-time moms. But ultimately, that black women advocate for themselves, that you feel heard, and that your experience is validated.
So when you walk into that office, feeling like the person who's sitting across from you has your best interest at heart and is able to speak to the issues that are relevant to you.
Nia Watson, ABC 10 News.